Hi, my name is Becca Ironside. I'm a physical therapist in the state of New Jersey, and the purpose of this video is to talk about perineal pain. So if you're having this sort of pain, imagine that you're sitting in the saddle of the horse, and those little muscles that are in contact with that saddle are inflamed, angry, and upset. You might have this pain when you're sitting down, when you're walking, or even while wearing tight clothing. It might seem frightening to think about what this pain is doing to your body, so what we want to do is teach you some methods to release the muscles that surround these very delicate muscles. These larger muscles that attach to the pelvis are going to be able to take more of a beating. They are powerful muscles. They can take a massage. We're going to show you ways to release the large muscles around the pelvis, which will thereby decrease saddle pain and perineal pain, which would be located right here. Now we're going to show you 3 techniques that you can use to release the muscles around the pelvic floor so as not to irritate them. In this first technique, we have the patient in a semi-reclined position with her legs spread. It is important that her knees are supported by pillows, and the rationale is because we are releasing these very muscles right here. And if she did not have any support, she would be activating the same muscles that she is intending to release. First, we'd ask this individual to find her own pubic bone. And she would do that by starting at her umbilicus or belly button, creeping her fingers down until she feels a hard, bony prominence. That's her pubic bone, where this X is right here. Then, this model will begin by releasing her own inner thigh muscles. She'll start just to the side of the pubic bone, and she'll massage out to the inside of one thigh. She can do this in both directions. That's the beauty of it. And she would do this for up to 2 minutes. It's crucial that she would be using lotion to decrease the friction of the tissues, and we would recommend paraben-free lotions or coconut oil. If she finds a trigger point spasm or an area of irritation, she can stay there a little bit longer. So she would do this 2 minutes each side. Positioning is very crucial. This is the inner thigh glide. This next technique is known as a perineal glide. So, this person is in the very same position as the last technique that we've performed, only in this case, she is going to reach down to her pubic bone, which you've seen, and she's going to take a finger and swipe from her pubic bone all the way down to her sit bones. She's going to do this repeatedly. Again, using lotion is critical here to relax the tissues. She would do 10 swipes. Why? We're doing fewer of these because we are closer to the delicate tissues of the perineum. It is important during this technique that we remain off of the labia and off of the scrotum. So we're just off to the side in the seam of where your underwear would go. And we're going to show you this on a model here so that you can get the idea. We're not directly here. We're off on this side, off on that side. 10 swipes. Make sure you use a lotion that is not going to irritate these mucosal linings or delicate tissues. So the third technique that we're going to show you today to release the larger muscles around the perineum is called a buttock glide. So in order to perform this activity, the model would be on her side, and she's going to reach down and start at this sit bone here. She's going to start just inside at that real meaty part of the bum and pull up her crack until she feels a hard bony prominence. Good. She's going to swipe in this direction a few times. And then, after she releases these tissues, she's going to fan outwards to get the entire gluteal muscle good and relaxed in this position. Now, obviously, this patient wouldn't be able to do this on her other side, so we would simply have her turn on her other side and use her opposite hand to release that. This is an important technique because what we see a lot of times with people with perineal pain is that they're clenching their butt all day long to brace against the discomfort they're experiencing. These muscles are responsible for a lot of pelvic tightness, and they can take a great deal of massage and pressure without discomfort to the perineum. For this butt glide technique, this model can actually perform this with a lot more ease if she's standing. Notice how one of her feet is up on a higher surface. This is easily done inside the shower. She can put her foot on a shower chair or the edge of the tub. So she's generating a lot of force that's going to impact and relax these buttock muscles. She can do this on either side. What we would recommend is, on the glides that she's going up the crack, she would do 10 times. She would then do 10 times on the same cheek, sweeping out towards the side and into the hip. In summary, we've shown you 3 techniques that can be used for patients and people with pelvic pain. These are fairly safe techniques. They can be used provided there's no incidence of active STIs, anal fissures, or rashes in the perineal region. If you enjoyed this video and you found it helpful, you can visit our website at connectpt.org to see similar information. In the meantime, try performing these activities for pelvic pain. We hope they help.